Hello, everyone. Welcome to the Gender Equity Unit's first webinar in our new series, Gender, Data, and Equity Expert Conversations. These are meant to be casual conversations with experts who are working in the areas of gender, data, and health equity. For those of you who are not as familiar, the Gender Equity Unit is part of the Data for Health initiative, which is funded by Bloomberg Philanthropies. We are located in the Johns Hopkins Bloomberg School of Public Health, and our work aims to serve as a knowledge center and resource hub for all of our partners and countries in the Data for Health initiative and beyond to integrate gender equity into their work. We also provide capacity strengthening activities focused on gender equity for partner liaisons and key country players. And we conduct research studies to demonstrate the importance of, barriers to, and strategies for advancing gender equity in global public health through data systems. We are very honored to spend the next hour with our audience from around the world. But a few notes at the top. We will have a Q&A session at the end of the webinar. Please feel free to write your questions in the chat throughout the conversation, and we will save them for the end. At that point, you will also be welcome to raise your hand and come off mute during that Q&A session to ask a question. We will also be sharing a very brief survey in the chat, if you could take a minute to fill that out towards the end. So today it is my great pleasure to host a conversation with Dr. Kahabuka. Dr. Kahabuka is the founder and managing partner of Cremes International. She is a medical doctor by training from Tanzania, moved into the health systems research space after learning her PhD. She has since worked with a host of partners to monitor and evaluate health programs, including work on sexual and reproductive health and gender equity. She's also worked to expand mentorship programs in sub-Saharan Africa for researchers. So Catherine and I met back in 2014 when I was doing some work in Tanzania, and we wanted to work with a local research firm. Catherine, I don't remember how I found you, but I remember being so impressed with your knowledge, your professionalism, and the team that you were leading. And to have a woman leading a research firm was especially impressive. So Daktari, karibu sana. Please join me in welcoming Catherine.
Thank you, Michelle. Thank you very much.
So I'm going to get us started by asking you a few questions on using a gendered lens when looking at data and health evaluations. So what does that mean to you to use a gendered lens in looking at data?
Thank you very much, Michelle. And let me start by saying that I'm very honored to be here today. And it has been great reconnecting and doing this with you. I remember your study was the first study for my firm, so I'm very grateful, and it's an experience that I will never forget. So let me straight away respond to your question. For me, using a gendered lens to look at data means considering the impact of gender on the subjects being studied when analyzing and interpreting data. It's all about acknowledging the fact that gender may significantly, as it often does, it may significantly influence how various subjects and your study perceive or experience whatever you are studying. And this is oftentimes because of the societal norms, roles, and expectations associated with the various genders. Therefore, for me, I always find it very helpful to analyze all of the key study variables separately for men, for example, and women and other genders if present, as this may oftentimes reveal total different pictures compared to when analysis is conducted overall for all genders combined. And what I have found personally is that many researchers only conduct a gender analysis for quantitative studies, but I have personally also done this for qualitative studies. And in fact, I can share an example from my most recent study that my team conducted towards the end of last year. In that study, we were collecting information. It was both qualitative and quantitative. In other words, it was a mixed method study. But the example I'm sharing is from a qualitative component of the study, where we interviewed youth trying to explore their preferences when it comes to what they want to do in terms of job opportunities. So the study was aimed at informing a USAID-funded project that was aimed to improve youth employability and entrepreneurship. And among the key questions we asked was, what kind of work or job opportunities that they preferred. And when we analyzed the data overall, 2 job opportunities were predominantly preferred by youth, and actually an equal number of youth preferred both the 2 opportunities, and these were tailoring and transportation or driving. But when we analyzed the data by a gender lens, it was astonishing to find that actually the tailoring was exclusively mentioned or preferred by female youth, while transportation or driving was predominantly mentioned by male youth, with very few female youth mentioning that. So if we did not analyze the data using a gender lens, the team would have missed crucial information to inform programming. So I just wanted to give an example, a real example, just to clarify how we usually use a gendered lens in looking at the data at my firm. Thank you, Michelle, for your question.
Yeah, no, that's excellent. And that's a great example of how you can totally miss things if you're not using that gender lens to analyze all sorts of data, quantitative, qualitative, and otherwise. So if you're sitting down with a client, consulting on a project, as you often do, what are some of the top things that you advise them to do to take this more equitable approach to data collection or analysis?
Right. So before I share what I usually advise our clients to do in order to have a more equitable approach to data collection and analysis, maybe let me start by explaining my understanding of what an equitable approach means. For me, this means ensuring that your study sample and findings accurately represent the population that you are studying. So to achieve this, some of the top things that we usually advise our clients, first and foremost, is making sure that the study sample accurately represents the relevant demographics in the population being studied. And for demographics, I mean things like gender, age, race, ethnicity, socioeconomic status, disability, if possible, and any other relevant factors. And very often our clients have come up with a total sample size and the study size. And very few have offered us guidance on, ensuring that the sample is representative of the different gender at the study design stage. But this is improving. I must say this is improving. And also, rarely, some of the clients also offer guidance on how to achieve representation of other important variables such as ethnicity, and of course, socioeconomic status can be achieved at the data analysis stage, but it needs to be taken into consideration at the design stage as well. So to make sure that you have enough or sufficient representation of the different variables that are going to help you to come up with these different socioeconomic status groups equally represented in the sample. So in the study that we conduct, for example, in different sites, also we advise clients to not only have these pre-identified, predetermined sample sizes for the different subpopulation groups at the higher level, but also we want to make sure that we capture that in different study sites as well, because oftentimes, if I can give an example, women in urban areas may not have the same views or experiences as compared to women in rural areas. So you want to make sure that you also consider capturing enough sample from both sides, urban and rural. So this is something else that we advise, that in addition to having stratification or representation at the total sample size level, we also want to make sure that we capture this at the site level as well, for studies involving multiple study sites. So I also wish to mention that achieving sample size for the different predetermined strata in different study sites, to my experience, may be very challenging. And it needs a very well-trained team with proper data monitoring systems. If it's not done carefully, despite the predetermined sample of the different stratas that you want to capture in different study sites, for example, you may end up not capturing that if you are not able to monitor that very well. But fortunately, I must say that for our team, we are lucky that we are doing this very, very well. We have teams that are very experienced in making sure that whatever predetermined samples are achieved at the end of the day. But again, as I said, it involves daily monitoring of the sample in the different subgroups or subpopulations that you are targeting in different sites.
Yeah,
And
that's
the second,
oh, I'm sorry, go ahead.
yeah,
Please.
and I'm gonna be very, very brief on the second one. So the other thing that we advise is, of course, including equity-focused questions in the interview guides, and this basically means assessing the extent, whatever questions you're asking, making sure that you are capturing views from different subpopulations. But also what we've also found helpful in terms of advising our clients to have a more equitable approach to data collection and analysis, and is involving the key stakeholders, the various key stakeholders in the study design and implementation, and even analysis and interpretation of study findings. So the design also need to put this into consideration, because oftentimes insights from the key stakeholders, such as beneficiaries or frontline service providers, if it's a program, may be very helpful in terms of asking relevant questions, reaching, for example, the various populations that you're targeting, but also coming up with correct interpretation of the findings at the data analysis stage. So other minor things that also I wish to mention are making sure that data collectors are well trained in handling participants with different background characteristics, without introducing any biases, but also making sure that at the data collection stage, we are having male interviewers interview male respondents and vice versa. So this also needs to be defined at the design stage, because this usually facilitates openness, especially for sensitive topics. And in other cases, the use of peers to collect data among their peers, especially for among disadvantaged or hard to reach populations, such as disabled, female sex workers. This also facilitates participations and openness, leading to collecting data that facilitates equity. And finally, during the data analysis, the general advice is basically, and as I've said before, is just making sure that we compare findings among the different subgroups that we have targeted from the sample size stage, so that to identify disparities and inequities within the data that we have collected. Thank you, Michelle.
Thank you. You make so many excellent points. A couple of things that stand out to me are your point about considering other demographics that might, as academics call, intersect right? We focus on intersectionality, where you're looking at the experiences of subgroups. As you said, rural women might have a very different experience compared to urban women, or older women compared to younger women. So there are all of these multiple identities that might come into play. And so being attentive to that can ensure equity. And I really like what you said about making sure that data collectors are well trained in collecting data from all types of people, right? And sometimes having someone with that shared lived experience, as you mentioned, like with female sex workers, can be can lead to success, to gathering data, because that data collector will be more trustworthy to that subpopulation. So thank you for that list. That was great. How do you feel that the health research community has evolved over time? Do you feel it's easier to sell people on building equity or gender considerations into the design of data collection activities now than it was a few years ago?
Yeah, as someone who has done research for more than 10 years now, same thing supporting program evaluations, I would say absolutely yes. I have seen some changes in the, especially in terms of this sampling approaches. Increasingly, our clients are not just seeking general samples, but also they are trying to specify the targets for the various subpopulations within the larger sample, which is something that was not happening that often in the past. But I also must mention that from my observation, that most of the variables, the most commonly variables that have been considered are gender, meaning male and female, and geographical location, that is urban and rural. But there's less focus on other demographics, things like maybe age groups, targeting age groups at the level, at the stage of stratification of the sample, ethnicity, disability status. So these are things that I think, despite that, for example, programs are aimed at reaching everyone, we are not making, I think, sufficient effort on um, searching or looking to include views of these other demographics in the communities. And something else that I think I have observed recently is that many research funders now mandate the integration of gender and equity considerations in research proposals. And this requirement has been at least a driving force in encouraging researchers to incorporate these aspects more thoroughly into their work. And for Tanzania, this also is happening. And there is currently a great focus on universal health coverage in Tanzania, as you might have heard. And this has brought a greater emphasis and attention to understanding and addressing health disparities, which this now naturally extends to capturing data to try and establish where these inequities are, so that programs can be targeted at improving the situation to achieve the universal health coverage. So that are the only things that I can think of right now. Thank you for your question.
Oh, that's great. Yeah. And your point about funders now requiring this is a big one, because it means that resources are being put towards the collection of gender data and hopefully the analysis and use of it as well. So that's been exciting for me too, as someone who's been doing gender focused work for a couple decades now, to see that transition to where we're actually getting resources to do it. Are there any other systemic gaps in data information systems that you see where we're really missing opportunities to address equity?
Yeah, I can speak specifically for Tanzania.
Please.
I have been involved quite in the past in assessing the data systems, specifically for sexual and reproductive health family planning program, specifically. And there used to be a lot of gaps. That was a couple of years ago when I was involved in thoroughly evaluating data, program data at the national level. But recently, I'm aware that there have been a lot of efforts to improve the situations. Many partners have been working on actually improving the variables that are being captured by our data systems, and making sure that the digital health systems are expanded to up to the lower level of care. So as of now, the things that I have been hearing as persistent as challenges in terms of data information systems in Tanzania, which may be similar to other African settings, are, for example, the data quality. This is something that I think, despite a lot being done, we still have quite a long way to go. So the reliability of data within the digital health systems that is being collected is some of it is quite inaccurate, and it doesn't give an accurate representation of what's happening on the ground, which may lead to misjudgments and potentially cause an unequal distribution of healthcare resources and services. So this is one of the gaps that I am aware of. But also, even if the data is well captured by the system, the culture of using data to inform decision making is still not very good. So again, it may result in the programs not adequately addressing disparities and inequities if decisions are being made without utilizing the data. And some of this is not done purposely, because there is also lack of skills when it comes to actually analyzing this data, interpreting the data. I'm aware that a lot of NGOs are doing fantastic work in improving that, but new people are being hired every day, and those who are there also probably they don't have enough time to analyze the data and use it. So again, skills, lack of skills is also limiting the effective use of data to inform equal distribution of resources, for example. But also there are infrastructure challenges in some of the areas where the government is trying to improve data capturing systems. Things like unreliable internet connectivity, power issues may limit some of these efforts that are trying to facilitate capturing accurate data by using, for example, electronic data capturing systems. So these are a few things that I can think of as of now. Thank you.
Well, it might interest you to know that here in the US, sometimes policies and programs are made without looking at data to inform them, especially complete data systems, right? So that's something we struggle with as well. But you make an excellent point that with these digital technologies, being able to capture complete and accurate data is on the horizon, right? But there's still a lot of challenges, both in, areas where there might not be consistent connection to those online sources, as well as, if we're collecting data using mobile phones and, women don't have as much access to mobile devices, what does that mean for the data that we do collect? So a lot of issues to sort through as we continue to incorporate these technologies into our data collection, for sure. I want to switch gears a little bit and talk about mentorship and leadership, as I know these are very important to you and are reflected in all of the work you do. You've invested quite a bit in providing more African researchers with opportunities for mentorship. Can you tell us why that's so important to you and why mentoring women in particular is so critical?
Yeah, I may say that I believe many people would love to do what I'm doing, but it's not easy. Let me start there. It's not easy. People like me and other senior researchers may wish to mentor young people, but the challenge is time. Usually we have too much to do. So why I decided to really invest in this, I think I have two main reasons. And the first one above the list, I think, is my passion for supporting quality evidence generation. I'm very passionate and I really, really value high quality evidence, high quality data. But then I realized that as I have been working and supporting different evaluations, I realized that, you know, I cannot do this alone. If I want to have a bigger impact in terms of supporting quality evidence generation, I think it would be beneficial to capacitate young researchers, especially those who are passionate, who have the same passion in research, because that's one of the very key criteria in our program. So during COVID, specifically during COVID, I managed to start this program because there was less to do, and I have been continuing until now. And I must say that it is paying off a lot because it has actually facilitated me to delegate more. And one of the biggest lessons that I've learned is that with dedicated mentorship and training, including investing in the tools and approaches for simplifying concepts and facilitating the implementation of the various research concepts, which I have really invested time doing, I have seen young researchers doing things that I would never imagine they would have done in terms of, supporting a high level data or research activities, including data analysis, report writing, and things like that. And the other reason, which is related to the first, of course, is supporting career development in research. As I used to go to the field with young researchers, many of them express their interest in supporting, in advancing their careers in research. And there was less opportunities in terms of, meaningful training to support them in doing that. So the passion I used to hear from them while I was with them in the field, combined with my passion for supporting quality evidence generation, I think those two things really made me start and very, very committed to running this program. And your second part of the question, which is why mentoring women is particularly important. Personally, I feel that women are often underrepresented in research, particularly in African setting. I've seen a lot of strong researchers, males predominantly. So I think this also leads into the underrepresentation of women perspectives and ideas in research, issues that are important to us women. If we are not able to lead and in designing the research and bring these research ideas and lead meaningful research, then I think our ideas, things that matters to us, would be underrepresented. So by mentoring women, I think also helping bridging this gap and, bringing a wider range of viewpoints and solutions to the table, which again, caters for, facilitating equity in terms of evidence generation to inform programming.
Yeah, I remember when we worked together on a project, how much time and care you took with new data collectors. Oftentimes, for a lot of them, this was their first gig as a researcher, as a data collector, and they really looked up to you, not only as a supervisor, but as a mentor, because you took the time to really mentor them on how to do this well and how to grow in their positions. And I know that they valued that very much.
Thank you.
What about your mentors? Does anyone stick out to you that's been a great mentor to you over the years?
Well, I must say I have had many mentors, including yourself, of course. Every time I work with senior researchers, I learn a lot. I learn a lot because I love learning. So I ask a lot of questions. I learn from the way they do things, and most of them are very open in sharing, their experiences and how to do things. And I have been collecting best practices from different people and putting these together. And that is what is informing most of my training materials currently. So I cannot say I have one person specifically who is mentoring me, but I'm lucky to receive continuous mentorship from the different individuals I work with for the different studies that we are supporting.
Yeah, I love that. And I often encourage my students, my mentees, to reach out to multiple people, right? One mentor is not going to do it all for you. And I
Yeah.
tease my student, this is not a monogamous relationship, right? You need to be getting things from multiple mentors, depending on what project you're working on or what you want to achieve in your career or life. So I think having multiple mentors is a great thing. So a couple more questions about mentorship. We're particularly interested in this topic because the Gender Equity Unit is starting a mentorship program for those who are affiliated with Data for Health. But we're looking for people to serve as mentors from all over the globe. And Catherine, I hope we can convince you to serve in that role as well. But how might you suggest that we better support folks particularly in low and middle income countries who want to grow into careers in global health or in research and data? How do we empower them in those fields? What's your advice there?
Right. From what I personally feel, and these are my personal views again, since when I was doing my PhD, I felt that there was very limited promotion of locally driven research. I see that many of the research topics, research are coming from are influenced by researchers from the North. So if someone is not working on something that is really close to their heart, something that, is they feel would bring the impact they want to see, then I think that's, for me, it's a great starting point, like promoting locally driven research or supporting and funding research initiatives based in low and middle income countries, encouraging local researchers to, design studies that are more relevant to the needs and context of these countries and supporting them to actually do those studies, that are meaningful to them. But this, of course, needs to go hand in hand with meaningful capacity building and training and mentorship, as you said. So offering education, training, capacity building to empower these, researchers with the skills and knowledge they need to, do this more effectively. And the other thing I feel is, as we are doing research that matters to us, I think also providing us with platforms for sharing, the evidence, funding for evidence dissemination, or creating stages and platforms where we can share the insights and experiences from, conducting these locally driven research initiatives. And this can be through different aspects like conferences, journals, online forums. I most often, we do research, but then if it's not influenced by researchers from the North, usually it's difficult to get access to for dissemination and share and get feedback on your findings and methodologies, which oftentimes helps in improving, or informing future research initiatives and improving the methodology as well. So those are some of the things that I think are relevant, but also, as you mentioned, including local individuals, prominent local researchers, supporting them to be able to also serve leadership and, mentorship training, because they oftentimes have a better knowledge of the context and the context of research in their countries. It's easier to also support a meaningful training and mentorship, also bringing the context into perspective as we are building the capacity of our local researchers. So I think these are just a few things that I could come up in my head at the moment. Hope it's
Yeah,
helpful.
I
Yeah.
love that. Yeah. And I've seen a real shift in the research world to take that approach where you're working collaboratively with people within a country rather than, global north researchers just saying, here's what we're going to do, but how do you design this research and research questions, together with people in the context, right? And that can be so much more powerful, and lead to research and data that is more usable, right? And is more meaningful to folks within a community or a country. I also like what you said about not just building capacity to collect data, but capacity to analyze it and disseminate it. Oftentimes, I'll speak for some researchers in the global north, we run out of time at the end and we leave that side of it, right? And that does a real disservice to our collaborators in country when we're not disseminating information together in whatever way that takes form. So I love those points that you made. So I just want to invite our audience to submit questions if you have them, or to raise your virtual hand if you want to come off mute and ask Dr. Catherine something directly. Maybe as we're waiting, I will ask you another question about mentorship. You've spoken a little bit about this, but how do you practice mentorship in your daily life? What are you doing on a day-to-day basis with your team, with other people that you come and that you have relationships with? How are you mentoring day to day?
Yeah, maybe I can say the big difference from how I was operating before I started a mentorship program. So in the past, it was just training data collectors. They go to the field, they collect the data, and our relationship ends there. And I did not invest that much in making sure that I keep on giving them feedback, which is something that is happening currently. Basically, I offer mentorship daily, as you correctly said. So the beauty is the people that we are working with under my firm are all part of our mentorship program. So whenever they are involved, so the first stage is that they are trained, they are given training and assignments and given feedback. But when we are comfortable that they have grasped the skills and knowledge very well, then we engage them in actual research activities for our clients. And this would range from data collection, data management, transcription, coding, analysis, even report writing based on their skill level. But as they're doing that, because that is my work, I work as a researcher and I do research every day. So now, as they're doing this as part of mentorship, I offer them feedback daily. I can just give an example. Even currently, there is a team who is conducting interviews, and we have one mentee who is doing qualitative interviews for the first time. And I was listening to the interviews yesterday and offering feedback, telling her what to improve. And I do this also when they do coding, when they do data analysis, transcription. It's specifically, we do that when we are training them, but when they are part of actual research activities, I take it more seriously, because then also we want to make sure that the quality of the deliverables are as we want them to be. So this is how I practice mentorship on a daily basis. So I invest a lot of time in offering really time feedback as they're supporting the various activities for ongoing activities for our clients.
So if I understand correctly, your
Yeah.
mentorship program is part of your firm setup. You have it built in to the structure of your
Yeah.
research firm.
Yeah, yeah,
Oh, that's
definitely,
excellent.
yeah. So we don't outsource when and it's really working well for me. I'm very proud of it, because in the past, when we have a study, we have to advertise, but currently we just, we don't advertise. We have the team, a large team that is already trained in research methods, data collection, ethics. So it's just offering them a refresher training and yeah, and additional feedback as they're working.
That's great.
Yeah.
All right, we have a couple of questions that have come in through the chat. The first one is from Kapangala. He says, Dr. Kahabuka, you mentioned having many mentors you met through projects. For aspiring researchers, what are your tips for intentionally reaching out to potential mentors, especially when we might not be working on the same projects yet?
Dr. Kapangula, that's a great question. Unfortunately, I have not done it that way. So what I would have advised as a researcher, if you're already working with any senior researcher, is just making sure that you have a good relationship with them, a good working relationship, being proactive to take roles, and that's how you learn. Volunteering to take tasks under their supervision. For example, I have done that multiple times. Like I want to be part of manuscript writing, for example. I want to be part of data analysis and report writing. So that way you get mentorship within an ongoing activity. It's difficult to request because most of people who are highly experienced are very busy. That's my experience. So most oftentimes it may be difficult to get effective mentorship that way.
Yeah, and I would also add that it can be very flattering to have someone say to you, I'd like your mentorship. So I think for aspiring researchers, don't underestimate the fact that you're going to, make someone feel valued by saying to them, I would like your mentorship in this area. Oftentimes, senior researchers will find a way to fit it in if they feel that it's important.
Mm.
So we have another question from Eric. Could you comment on how other gender identities, including LGBTQ populations, could impact research? Do we need to consider them, or is it still early, especially in Africa?
That is for my country. I think we have a long way to go. It's important to capture, and I think I was having a discussion with someone recently regarding representation of such populations in their evaluations of programs, for example, because they are also using the services. We don't know the challenges they're facing because we don't make efforts to, get their views. So I agree, it is important, Eric, but I think as researchers, we have to find a way of making sure that their views are represented.
Mm-hmm.
Yeah.
Yeah, and sometimes it takes a lot of care to be able to do that in a way that's safe for those populations and for the researchers, right?
Yeah.
To make sure that we're getting that data without putting people in harm's way. So a lot of challenges in many countries around that. But yeah, eventually we'll find a way to address it. I have another question from Bhakti. Is there involvement from the Tanzanian private sector for health research? For example, for employee health attitudes and behavior? Has the Tanzanian private sector been involved in health research, particularly in terms of the push for equity?
I'm not sure whether if I got this question correctly, because I'm also a private sector and I'm involved in a lot of research activities, including at the national level, evaluating donor-funded projects, large donor-funded projects in Tanzania. So probably the answer is yes. It depends maybe who you're working with and the kind of projects you are involved in. But there is a lot of collaboration between the private, I think, and the public sector currently.
That's great. And oftentimes you get a lot more done when you have that collaboration, right?
Okay.
All right, I have a question from Gloria. How do you foster equity during dissemination of data? As we understand that in most communities, especially in Tanzania, equity is still a new approach. So equity during the dissemination phase.
Yeah, I'm trying to think of the different dissemination platforms, conferences, community meetings that we do in the community by the government. Usually relevant people are invited. In conferences, you don't have that much control because people sign. When you write an article, you don't have control who reads it. But I think the most important thing is making sure that the data is representative of the different populations in the community, so that whoever you are presenting the information to, their information is also relevant for them. So I think for me, that's what I would see as something that needs more work as compared to us, the platforms that we are using for disseminating findings. But Michelle, please feel free to add. You're an equity expert.
No, I think that's exactly right. And, reporting on the data from all of those subpopulations. So even if you don't have, as much data as you might need to see, significant relationships between variables, still reporting on trends and making the point that we need more data on these subpopulations can sometimes help to promote equity in those dissemination opportunities. All right, these questions are pouring in. People are loving what you're saying, Catherine. So we'll keep going for a few minutes.
Great. That's great.
From Melvin, are there any best practices or guidelines for organizations to follow when collecting, analyzing, and interpreting gender-related data to avoid generating biases?
Can you read that again?
Are there any best practices or guidelines to follow when collecting, analyzing, and interpreting gender-related data to avoid generating biases?
Yeah, I think, and Michelle, please feel free to add when since you know a lot about this. I think the person who asked the question did put it correctly, that the gender lens is supposed to be applied at all phases of the study, from the study design, implementation, analysis, and interpretation of the findings. So making sure that you have as I said, an accurate representation of the different demographics from your population, the population that you're studying, I think is a great starting point, because oftentimes we want to do that at the data analysis stage, and then we don't have sufficient representation of the different demographics or subpopulations that we want to analyze for report on. So I think that's one of the best practices, and I think that is where there's a gap. If you ask me, most of the time we have a sample, a general sample, and then we send people to the field. And we don't tell them, make sure that you include this percentage of women, this percentage of men, this percentage of this age group, and, older, younger people. And if you don't do that at the design stage, it's very difficult to have a representative conclusion and then analysis and interpretation. So maybe, Michelle, you can add something else, but I think that's what I can speak on. Other things I said already at the beginning.
No, that was a beautiful response. And you made a similar point earlier that I thought was great, in that making sure that you're collecting enough data to represent subpopulations. In this case, we're talking about making sure you have gender representation. And sometimes that might require more effort, right? You might have to oversample or use other methods than you normally would in order to make sure you're getting data from all of those subpopulations. And so it can take more effort, more time, but in order to truly be equitable, we need to put in those efforts to make sure we're collecting data from all people. All right. I think we have time for one more question. This one is from Viona. Do you think it will ever come to a point where junior researchers get recognized compared to senior researchers? And Viona says, I think the gap there is too loud. And I know this can be especially hard for female junior researchers. Oftentimes there's this feeling of power imbalances with more senior experienced researchers, especially when they're men. So what are your thoughts here? How can junior researchers speak up and get more recognition for their work, especially if they're women?
Yeah, I think I've heard this from my mentees. It's a struggle. So Viona, I feel you. It's a struggle. I've had it multiple times. Most of the junior researchers are doing fantastic work in supporting a lot of studies, great studies that senior researchers are publishing, and in terms of the data collection, and but then they end there. They don't get recognized, and of course, there's a limitation to the number of authors, for example, and it's not possible to list everyone. But I think as senior researchers, we can try and maybe through mentorship support them to write, publish, so that they can be first, second, third authors, but also whenever possible, include them in whatever publications that we are doing. As of course, I was featured in almost 14 publications for the first study we conducted, Michelle. So, and many people did. So I think that's one of the best practices to make junior researchers, impact seen out there.
Yeah, that's great.
Yeah,
you brought it full circle again with mentorship. So thank you for that.
yeah.
Well, we've reached the end of our session today, and I want to thank you to everyone for your participation. There were so many great questions. Unfortunately, we couldn't get to all of them, but really appreciate you putting your thoughts in the chat. I also want to thank you, Catherine, Asante Sana, for your time and wisdom. I really appreciate you joining us today. For those who have joined, please sign up for the Gender Equity Unit's newsletter and follow us on social media. You'll hear more about our upcoming webinars, including one we have coming up on February 26th with trans activist and researcher, Dr. Will Cole. But Catherine, thank you again, and we look forward to seeing everyone next time.
Thank you so much for having me, Michelle and Tim. It was an honor once again. Thank you. Yeah. Thank you, everyone, for joining.